Bonjour et bienvenue à ce...
Hello and welcome to this press conference from the Montreal Regional Public Health Authority. This is broadcast on Santé Montréal's Facebook page. We will begin by some comments from Dr. Mylène Drouin, Montreal's Regional Director of Public Health. She is accompanied today by Dr. Paule Lebel, Medical Advisor, Montreal Regional Public Health Authority. A reminder to the reporters who are on the phone, we ask you to put your phone on mute, and we're asking the radios to not put any calls on hold so that you don't end the call. So, Mrs. Mylène Drouin. Hello, everybody. Hello to Dr. Lebel. Thank you for being with me today during this press conference. And there's a special topic, which is the health of our elderly, a topic that we've talked about very little over the past press conferences. And I really wanted Dr. Lebel to be with me here today because she's a specialist in public health when it comes to prevention and the organization of services and care for the elderly. So thank you for your presence. So the situation in Montreal and Greater Montreal is very worrisome. The modelization that was published this weekend by the Institut National de Santé Publique invites us to remain prudent when it comes to a reopening of certain sectors of activity. And as I said during the last press conferences, in addition to having to control the transmission of the virus, all of the essential conditions to safe deconfinement must be there before we can, as a metropolis, think about a reopening of different sectors. The situation today, close to 20,000 cases, 19,678 cases, 386 new cases over the past 24 hours. Unfortunately, over 2,000 deaths. The great majority of them, 85% of them, are in closed care centers for our elderly, so RPAs and CHSLDs. And we've also got close to 3,743 healthcare workers who now have the virus, and that represents more than 20% of our total cases for the Montreal region. So clearly, the health network still has a lot of work to do in order to control these outbreaks in care settings, which really paint the picture for Montreal as a whole. We get a lot of requests from the boroughs, from our partners, concerning the territorial stats and the territorial actions, and we're very conscious of the necessity to sometimes have approaches that are adapted, especially in hot sectors. And I'm pleased to announce that as of tomorrow morning, on our website, all of the detailed information by borough will be made available to the population. This will allow us to better understand the distribution of the cases, whether it's in open or closed settings, healthcare workers, and the hotspots, so that we can better understand the current transmission on the island of Montreal. I thank my team for having worked on this. The point that perhaps is a bit more positive since last week in terms of new hospitalizations due to COVID, we've reached a plateau which has maintained itself. And we also have a slight decrease in terms of new admissions to intensive care and to the emergency department for COVID-positive patients, which is an encouraging sign. And now we have to make sure that we maintain this plateau, and ideally that we see a decrease, a progressive decrease. And I think that is by controlling community transmission that we will be able to maintain this plateau. Last week, we presented to you the strategy so as to increase screening, COVID screening within the population. Our objective is to have more than 3,000 samples per day already in the fixed centers, the screening centers, versus last week in April where we had an average of 1,000 screenings per day. We're now at 1,900 screenings per day in these centers. And our labs can give us results in less than 24 hours. So that is nice progress, and we're going in the right direction. To these numbers, we can add the deployment of the mobile units that we announced last Tuesday. Currently, we have 3 buses in the field doing screening tests. So over the past few days, we've done more than 500 screenings with these mobile units, and we will have 5 of these units by the end of the week. These mobile units, obviously, that go in hot zones, in neighborhoods that are less well served by a fixed site, and where there was an increase of cases in the past 14 days. We obviously invite you. Well, currently, we're at about half of our capacity for tests in these buses, so we invite the population to consult as of today, but also look at the schedule for the next few days. We'll be on our website, Santé Montréal, so that you can know in which neighborhood these mobile units are. And obviously the fixed sites as well. You have their business hours and how to make an appointment, or you can go without an appointment in some of these sites. So now I'm going to get to the heart of the matter. We wanted to talk about our elderly. I would like to remind you that in Montreal has over 275,000 people aged 70 and up. People, the third of them, live alone at home, and 90% of them do not live in CHSLDs or in RPAs. Over the past few weeks, and this is absolutely normal, we've talked quite a bit about the dramatic situation in the CHSLDs and RPAs, but today I wanted to bring your attention to all of our elderly who are at home and for whom we ask them specifically to isolate themselves and to reduce as much as possible their outings so that they can protect themselves. These elderly are at home, and they count on their support network and their families or community organizations to meet their needs. And I take this opportunity to thank all of the community organizations that are working closely with our elderly. The data confirm it. Our elderly are much more at risk of having severe forms of COVID. For 70 and up, it's 11 times greater chances of having complications if we compare to 50 and up. And when we look at the 80 and up, it's 22 times more likely to develop a severe form of the illness. So if we ask the elderly to avoid public spaces and to maintain physical distancing, there's a reason for that. There's good reason for this. If we ask them to self-isolate or at least to reduce our risk, well, there are consequences on their health, because parallel to this confinement, what we can see as well is a whole issue of isolation, of psychological distress. We can also think about the whole issue of malnutrition. When we're alone, we cook less, we eat alone. Often, we don't eat as well and in smaller quantities. So malnutrition is an issue and increases a risk of infection, of weight loss, of muscle mass loss, and there's a risk of falls. And there's a whole issue of physical deconditioning. So by reducing physical activity, and Dr. Lebel will talk to us about a program that we'd like to launch today, a program that we've called Le Go en Bouge pour Bouger, which really aims to bring our elderly to remain active even when they're confined. So I will let you explain this program. I would like to speak to the elderly, but also to their families, to all of those around them, the stakeholders, the volunteers on the phone, their neighbors, to encourage the elderly to participate in this wonderful program, Le Go pour Bouger. And I would like you to take note of the address, because you'll see that on the Santé Montréal website, you've got the exercise program. So why did we decide to launch this exercise program? Well, firstly, it's because it's very important to conserve a solid muscle mass. This will help prevent falls. It will also help to stay in a better mood and also to keep our vitality. So we suggest that you follow this exercise program several times a week. And what are the characteristics of this program? First of all, it's very short, 15 minutes. It's very easy to fit that into your daily routine. And secondly, you can find it online with videos that illustrate each one of the exercises. You can also find it on a sheet with all the pictures that will allow you to understand the exercise in question. In addition to this, what I really appreciated in the creation of this program is that there are 5 different blocks of physical activity depending on our physical condition. So if we're very healthy, then we choose a block. If we use a cane to walk around, we can use another block of exercises. If we're in a wheelchair, there's another block for that as well. So all of the elderly can be physically active at home in a room of the house with very little material. So it's truly for everybody. And I'd like to hear a sentence in Montreal. Did you do your logo today? So that's an exercise for all. And I invite you to encourage the elderly in your life to do so. And I thank the Move 50 Plus team in the Eastern Townships that helped us with this program, Dr. Kwak and Diane, and our public health team, a wonderful collaborative work. Thank you. I will finish by talking about the automated calls that we announced 4 weeks ago, a collaboration with the City of Montreal and the 211. So the operation is a great success. We've reached 225,000 elderly people thanks to these calls, and it's more than 1,000 elderly who got support from 211 to meet certain needs. Obviously, we will continue this collaboration, and especially in the context of the next few months with the heat that's coming and all the challenges that we will have to face, and obviously the fact that the confinement measures have not been lifted for Montreal. Finally, I would like to end by saying something that's very dear to me. The confinement of the elderly demonstrates as a society how essential they are. We see it in the community environments in terms of the reduction in the number of volunteers and of caregivers, with families, with the support that we got from our parents and from the people dear to us. And I think it's a time where we have to respect public health directives out of respect for our elderly, because the faster we can collectively flatten the curve, the quicker they will be allowed to go back to a normal life. So if everybody respects the recommendations, I think that it's also one way of saying that we are in solidarity with our elderly who were asking to stay home. So let's do this all together. Thank you.
A few words in English. The Montreal situation is, je recommence. As we've seen this weekend, the epidemiological situation of Montreal preoccupies us. Today, we have more than 19,878 cases. We deplored 2,000 deaths, most of them being linked to the outbreaks that we're seeing in CHSLD and RPA. And we have more than 3,700 healthcare workers that have been infected by COVID-19. That represents more than 20% of all the cases that we have in Montreal. So this is a situation where we still have a lot of work to do in the community, but also with the outbreaks that we're seeing in the CHSLD and elders residency. We have had a lot of people asking us to give portraits of what is being done and what we're seeing in specific neighborhoods. Tomorrow we will have on our website those portraits available for all the population to see what is happening in the different boroughs of Montreal. The good point we're seeing is that since last week, we're seeing a plateau in the number of new hospitalization linked to COVID-19, and we're seeing a reduction of new intensive care unit admissions and emergency admissions for COVID-19. So what we need to do is to maintain this plateau or this reduction to see the end of the pandemic. Last week, we've launched the regional strategy to increase the screening, the testing that we're doing at the population level. The objective is to do more than 3,000 a day. Since the end of April, we've almost doubled the number of screening, passing from 1,000 a day to almost 2,000 a day in the center for screening that are in different neighborhoods. And we've added unit mobiles that are going around Montreal. Today we have 3 in services, and at the end of the week we will have 5 of them going in different neighborhoods. So you can have the schedules and the places where the unit mobiles are on our website, Santé Montréal, and we're asking people in those neighborhoods that have symptoms, or people that do not have symptoms but that have been in contact with someone that is symptomatic or was sick, to come to the unit and get tested. We have a capacity for each unit of more than 200 tests a day. And today I wanted to talk more specifically about our elders. And a subject that is quite important to us, because we're not deconfining right away, and we know that we are asking a lot to them. If in Montreal we have more than 265,000 elders of more than 70 years old. A third of them live alone in their house, and 90% of them are not in CHSLD and RPA. As I said, we have looked a lot at the critical situation in those establishments, but I think it's important to also make sure that we care about the 90% that are at home, currently at home. We know that, of course, they are more at risk of having a complication or a severe form of COVID-19. People more older than 70 years old are 11 times more at risk of having a severe form of COVID-19, and people over 80 years old, it's 22 times more at risk. So that's why we're asking elders to stay at home and to reduce at most their movements outside of the home and their contacts with other people. But confinement has also other impact on health. It causes isolation, psychological distress. Of course, we can see malnutrition or nutrition problems linked with the fact that people do not, they have to eat alone, they prepare less meals. And the other thing that we see is deconditioning or reduction in activity. And that's why we are launching today a new program that was developed in partnership with Move 50 from a Cercovie from l'Estrie, the region. It's a program where we're asking you elders, but also families of elders, to go on our website, and we have different units, 15 minutes units of activity that are really adapted to all conditions. If you are healthy, if you have difficulty walking, you're in a wheelchair, you have 5 different categories of activity that can be done at home. And we're really asking people to do it, because at the end of confinement, it can make a difference in your autonomy and the risk of falls, or the risk of, and on your mental health, of course. So I think that was the main message that we wanted to share today. I think we have all together. We have to be solidaire, to be solidaire for our elders by respecting the public health recommendation. We're also respecting our elder and making sure that they can also come out of the house earlier, or they can go back to a normal life soon. So thank you. I think it's all together that we have to give this message to our elder.
Merci beaucoup, Dr. Drouin.
Thank you very much, Dr. Drouin, Dr. Lebel. And now we'll go to the question period. I'd like to remind reporters that they can ask 2 questions. Thank you again for having your phone on mute. And we're asking the radio stations to not put the calls on hold. So, Isabelle Laplante, TVA. Hello. Dr. Drouin, you talked about 1,900 screening tests done per day in Montreal. And you made a distinction between the tests that were done in the mobile units. So if we really include all of the screening sites in Montreal, how many are we doing per day? Well, currently, if we calculate, there are 3 places where tests are done. There's in care settings, in hospitals, and we would have to see either with the government or the hospitals have the stats. So on the floors, the outbreaks, etc., healthcare workers in care settings, that's several thousand in Montreal. There are the screening centers, which are the fixed sites in the neighborhoods. So as I said, there's been a nice progression, and we're now on average at around 1,900 per day. And to this, we add our mobile units. Currently, we've got 3 that do about 100 to 120 per day. But the capacity that we've got is really, we'll be able to go beyond 200 easily, or 250 per bus per day. Now, what we need, obviously, with the schedules that will become more regular and better known, what we will do with all the work that we'll do, we hope that the population will come so that we can reach the full capacity of our mobile units. So in the mobile units and the screening centers, we're probably today at around 2,200 to 2,300 tests per day. We want to go up to 3,000 at the end of it. And there's all the screening that's being done in the care settings, but for which I personally don't have the numbers. You qualified the forecast of the INSPQ for Montreal of very worrisome. Is it still realistic to think that we will reopen schools and businesses as of the 25th of May in Montreal? Well, I think that the modeling demonstrates clearly that we've got to control the virus before we can reopen, and we're far from being there currently. So it's possible that we will delay the opening, and it's going to be part of my recommendations. But I think that the government, we're reading the same numbers, we're looking at the same elements. We can also see that, like I said, you'll see in the epidemiological curves, there's a whole part from March where it was mainly travelers coming from abroad. And then afterwards, we really see in the curves a distribution, the people in elderly homes, healthcare workers, and a little bit in the community. And now we're seeing an uptick in the community where a proportion of the new cases is more significant in certain sectors, and it's less so in the CHSLDs. So that's why it's important to go test and to re-flatten the curve and to see what is the link between healthcare workers, infected healthcare workers, and what's happening in the community, and how can we break that chain of transmission? How can we stabilize the teams of healthcare workers in CHSLDs? Because if it's always new staff coming in, well, they get infected, they leave because they're sick, they go into the community, and then they reinfect other people. So we absolutely have to find a way to break that chain of transmission quickly.
Qu'est-ce que je fasse? Il est déjà monté.
La parole est maintenant à François Carabin du journal Métro. Tu es en ligne.
Oui, bonjour, Dr. Lebel.
Hello, Dr. Lebel, Dr. Drouin. Thank you once again for taking our questions. My first question is for Dr. Drouin. You talk quite a bit about the screening objectives in Montreal. Obviously, from what I understand, it's important to have an accurate picture of the situation in Montreal. This said, there are certain neighborhoods where we're observing a rate of mortality that is increasing, and it's a worrisome rate. I'm thinking, amongst others, of Montreal North, but also Hochelaga Maisonneuve more recently. I was wondering if there are measures that you can put in place immediately to slow that rate of mortality, to make it come down. or once the screening is advanced, what can we do, what can we put in place, once again, to make sure that there are as few deaths as possible in Montreal? I think that we have to distinguish between the evolution in the number of cases from the evolution of the number of deaths. The deaths, 85% of our deaths are in closed environments, which are, nursing homes with people who are very vulnerable. And the approach to reduce these deaths in these types of environments is really controlling the outbreaks and preventing these outbreaks. Obviously, there are a lot of places where there's already, there are already hot zones, and the prevention teams are controlling the infections are there to try to make sure that the practices are in place to control the outbreak. And we've obviously got a whole, what we call our prevention brigades. They are doctors who go through all of the nursing homes in Montreal where there is no outbreak or there is a single case, and we're working with them every week to improve their practice to make sure that there is no outbreak in those establishments, because we know that places where there are some people who are trying to put out the fires, but we also have to prevent in other places. And I think that it's in these environments. If we want to reduce deaths, it's really by acting in environments where we have vulnerable populations, because they are the ones who have the most severe complications and the highest rate of mortality. When we talk about screening or tests in the population, it's really so as to reduce the transmission, the community transmission. And yes, it's going to allow us to have a better picture, but beyond the picture, our objective is truly to identify these people, to investigate within 24 hours, that's a gold standard, to identify the contacts, to isolate the contacts, and then once we start to test people who are asymptomatic, who perhaps were in contact with a healthcare worker or with somebody who is sick, well, we want to make sure that there might be a person who's COVID-19 positive, who's asymptomatic, that we can also get their contacts and cut that chain of transmission. But obviously in the community transmission, we want to flatten the curve. And clearly we are trying to protect the most vulnerable, those with chronic illnesses, the elderly, and that's to reduce mortality rate. I hope I explained correctly. My second question is still for you, Dr. Drouin. Summer's coming, and you are used to managing heat waves in Montreal. We don't know what the summer is going to look like, but how are we getting prepared for a summer that could add a heat wave to the pandemic? We're already working on that component. We should launch, yes, I think it's this week, we're the 15th. So this week we should launch, normally it's the 15th of May that we launch our annual heat wave plan, and we're working very closely with the city to look at how we're going to adapt, obviously, air-conditioned places, pools, the opening of pools and all of this, because it's very complex. We're also working currently with the government, because normally there's a whole question of air conditioners in CHSLDs, they're usually installed at this time of year. Right now, this week, we should get certain notices to reframe these interventions in order to make sure that when we put in air conditioning, we are not creating another transmission vector. So we are, with the teams from the Institut National de Santé Publique and the Ministry of Health, we are adjusting these interventions, but we should be able to announce them at some point this week or at the beginning of next week, because normally our heat wave plan is announced on the 15th of May. I would like to add something. In these heat waves, over the past few years, we take care of the elderly who are very isolated. And the COVID crisis that we're experiencing right now has brought us to work even more closely with community organizations so as to identify these people who are very isolated. And we were very happy to know that we had a subsidy from the federal government that was given to us, several $1 million, to help us to structure even better a resilient city of Montreal that can face either heat waves or freezing rain, and now major infections such as the COVID, so as to support isolated elderly and to help them to get through these big stressful periods. So all the work that we've done with the community organizations over the past 2 months will serve us well. It will help us to be even closer, and we'll be able to work collaboratively during a heat wave.
Merci François. La parole est maintenant à Andy Saint-André de TVA.
Oui, bonjour, Dr. Drouin.
Hello, Dr. Drouin. You didn't talk much about the situation that is more and more worrisome in Mercier, Hochelaga, Maisonneuve. My colleague from the Metro newspaper mentioned it recently, but the number of deaths and of confirmed cases is increasing quite a bit. And I imagine that public health is keeping an eye on that. What is being done concretely in the field there to limit the spread of COVID-19, and what will be done to try to slow the spread? This afternoon, my teams are with the partners from that borough to look at what additional interventions must be made. Clearly, there's probably several explanations linked to this increase, which is probably linked to healthcare workers, but also to a community transmission, a sustained transmission, because of the urban density and certain social factors that make it so that this social distancing is not as easy to respect. Currently, it's the same strategies. We have to intensify the screening process, but also put in place some measures with the municipalities so as to increase physical distancing and to see if perhaps there are specific outbreaks in certain workplaces. But usually, well, I don't know if there are some specifically in Hochelaga, but the Santé au Travail team is managing on a day-to-day basis all of the outbreaks that are identified throughout all the cases that we investigate. So if there are some in that territory, there might be an explanation at that level. But the teams are currently looking at, are we going to intensify certain strategies in that territory? But it remains the same type of strategies that we have in place, whether in Montreal North or in any other hot zone in this city. We don't have specific measures, confinement measures, and obviously it's the awareness raising of the people they have to make sure that they respect social distancing measures and wearing a mask in public places. We will intensify this message in those places. Second question, Mrs. Drouin. The CIUS of l'Est de l'île de Montréal has asked public health an in-depth analysis to find an explanation to this increase in deaths in the borough. Here you're talking about factors or social factors. Perhaps physical distancing is hard to respect, but what does that mean concretely when the CIUS is asking for an in-depth analysis to find an explanation? What is public health doing? What are they doing in the field? You talked about the buses earlier. Is there a bus, a mobile unit that will go in the borough? Because you're saying that there will be some new ones. Well, the choice of the sites is done with the CIUS in question, so we look at the mapping, and according on whether they've already got some fixed sites, the mobile units, the choice of neighborhoods is made. So I don't have with me the calendar, but obviously I imagine in the next few weeks, if these are hot zones, there will be some strategies, some screening strategies to be added. What the CIUSs are asking us is what we're able to do in terms of the curve. How can we bring data to life so that we can better understand, is it more linked to cases in open or closed environments, outbreaks in the workplace? Is it more healthcare workers who become vectors of transmission? So this is what we're trying to look at with the data that we've got at our disposal. And between you and me, when we've got public health capacity that's the capacity that we've got currently, we can't afford to do studies and additional data collection. So we're working with the tools, because the important thing is to act so that we can put in place these conditions. So screening, investigations, managing outbreaks in the field. But I think that with the data and with the pictures that will be broadcast tomorrow, we're already working with this data since last week. I think that we've got enough information to be able to well target our interventions in the field without doing exhaustive studies that could certainly bring about certain nuances to our interpretation, but that perhaps would not change the interventions that much in the field.
Merci, Mme Drouin.
Thank you.
Merci beaucoup. La prochaine question est
Thank you.
Claude Pedneau de Radio-Canada.
Oui, bonjour, Dr. Drouin.
Hello, Dr. Drouin.
Bonjour, Dr. Lebel.
Hello, Dr. Lebel. My question has to do with another reality, a summer reality, the day camps. We talked to several organizations, several day camps who tell us that they're waiting for the green light from public health. And I wanted to see with you, has a decision been made when it comes to day camps? Will the children go to day camps this summer? That decision will be a decision that will come from the provincial level, like all of the decisions with sports leagues and sports teams. So the alignments and the risk analysis is done at the provincial level. And Montreal, because of the situation, like the opening of schools or other sectors, it's possible that there will be some adaptations for a big region like ours, which is not where the situation is not well controlled. But it's a decision that currently is being looked at the provincial level. Can we expect a decision in the next few days, in the next few weeks? I think it's in the next few days, but I don't want to make promises on things that I don't control. So, thank you.
Merci beaucoup. La prochaine question est à Ariane Lacourcière de la Presse. La prochaine question est à Benoît Chapdelaine de Radio-Canada.
Oui, bonjour.
Hello. I wanted to see if in the case of Montreal North, I understand that there's the CIUS du Nord de l'Île. They have some choices to be made, but your explanation, why was there no mobile clinic since the beginning in Montreal North? Well, because there were two fixed sites that were open, including one that's one street away from Rivière-des-Prairies, the hospital in Rivière-des-Prairies, and there was another temporary fixed site. Like I explained, the choice, well, the second explanation is that the mobile units are deployed progressively when we can find enough staff to do the screenings and nurses. So the first mobile unit that was completed was the one for the CIUS Centre-Sud. Then afterwards, it was for the CIUS de l'Est. And the one for the CIUS du Nord will start this week. I think now it's in Saint-Laurent, and as of tomorrow or the day after tomorrow, it's going to be in Montreal North. But we knew that there were two sites. So we worked with the CIUS, and knowing that there were two sites open in that territory, which were fixed sites, the team proposed that they go to Saint-Laurent first. And what I understand is that as of Thursday, I believe, well, for the next week, the mobile unit will be in the three arenas. So 2 days in different arenas throughout Montreal Nord from east to west. So that's what we're planning. So yes, there are still hot zones. And then afterwards, we have to look at the service offering in terms of fixed sites. And all of this is being worked on in collaboration with community organizers and the managers at the CIUS and obviously the partners to find the site with the coordination and the emergency measures. So it's quite complex, and it requires a lot of negotiating, and it also requires finding the staff at the correct time so that we can fill these buses appropriately with qualified staff. So that's what explains what happened. I had a second question. As to the elderly, I understand that there's many who like to do exercise, and you're encouraging them to do exercise, but a lot of them are very active. And for them, doing some exercise in their apartment or their living room, that's what they want. They want to go running, they want to ride their bike. What would you say to these people who are in great shape? I'll let you answer.
Ben, je pense
Well,
que
I think that
dans une perspective,
clearly
si quelqu'un est en très
if somebody is an elderly person is in very good shape, normally what we say, they have to isolate as much as possible. If the person decides to go for a walk or to jog alone, well, we consider that the risk is very low. But they have to choose times where there's not a lot of people outside, etc. If the person is really in shape and they can run at 70 and up, well, I congratulate them. And I think that there's a way to find a way to exercise in a safe manner in the context of COVID by limiting contacts with people who could be affected and transmit the illness. And I would say that luckily our elderly are often early birds. So running in the morning before there's too many people out, or to go for a walk and do some good exercise. And the program, the Lego program, is a complementary program. The more physical activity we do, the better it is. So the Lego program is there to reinforce a muscle mass, develop better balance, to prevent falls. So to go for a walk or for a run, well, that increases our cardiovascular health. So we want to have people diversify their physical activity and to increase the number of minutes of physical activity in a week.
D'accord, merci.
Thank you.
Merci beaucoup. La parole est maintenant à Jeanne Corriveau, Le Devoir.
Oui, bonjour à vous deux.
Hello.
J'avais une question concernant...
I had a question concerning the mobile units. Dr. Drouin, do you encourage people who don't have any symptoms or who did not have any contacts with a known case of infection to go get screened?
c'est sûr que on a une capacité limitée.
We've got a limited capacity.
On a, actuellement, la
Well,
capacité
currently, the capacity is not fully taken. It's around 200, 250 a day. So obviously, symptomatic people, we always prioritize them. People who had contacts with active cases, because we know that there are some people, or who were in contact with somebody who was sick. We know that there are some people who carry the virus but don't have any symptoms. We invite them. We don't recommend. There's a lot of people who show up and they say, well, my employer wants a test before I can go back to work. I wasn't exposed at all or anything. I'm not at risk. For us, this is not something that we're encouraging. But since these mobile units are truly in outbreak epicenters, by adding the component of people who were in contact with active cases and who are asymptomatic, we believe that even if the rate of positivity may be lower, if we can catch a few positive cases, we'd be very happy to break these chains of transmission, and we think that it's relevant. Do we do it throughout the island of Montreal? If I look at the West Island where there's hardly any cases, no, it's not relevant in a context such as that one. But I believe that when we are in zones where we believe that there's sustained community transmission, it's justified. Furthermore, we talk quite a bit about Montreal North, but are there other neighborhoods that worry you specifically? Or do you think that this situation could get worse? I think that you'll see it in the maps that will be published tomorrow. But obviously, this sector, the eastern sector, eastern Montreal and Montreal North, there's a lot of cases. And you will see, because our maps allow us to... There's no territory for which there's not a little hotspot. There's some in the west, but we've got a little bit less at the city. But the territories where there's something, where there's more cases, it's really eastern region and the northern region where we're going to intensify our actions. We've got 5 mobile units. If we see that the demand is there, nothing will stop us from adding more. And then in territories where we see that there is a greater need, we'll be able to intensify and redirect either the mobile units or that are currently used or new ones.
Merci beaucoup. La parole est maintenant à...
Thank you very much.
de la presse.
Bonjour, Dr. Drouin.
Hello.
Pouvez-vous parler dans...
Can you speak louder?
Est-ce que vous pouvez parler dans votre combiné?
Oui.
OK.
Est-ce que vous m'entendez?
Un petit peu.
Oui. Alors, ce que je souhaitais savoir, Dr. Drouin, Vous parlez d'une situation préoccupante.
You talk about a worrisome situation in Montreal.
Je dis également,
The Premier also mentioned it yesterday and today again.
il est maintenant question de cette possibilité de reporter le décès.
Now there's a possibility of delaying the confinement beyond the 25th of May. As the Montreal Regional Public Health Director, what is your recommendation, your official recommendation? Do you want the deconfinement or not on the 25th of May? I think that today it's difficult for me to say we're going to delay it, that I recommend it right away. We are also looking at the reopening of the sectors. So there's the retail stores, there's the schools and daycares. For us, there are sectors for which perhaps with low risk, we could have a reopening without increasing the transmission, the community transmission, while we're putting in place the conditions. When I look at the reopening of garden centers, I don't think it had a big impact on the community transmission currently. So we're also looking at these dimensions to try to see what can we deconfine. But for me, over the next week, according to the indicators and the conditions that we're following, when it comes to community transmission and our capacity and the healthcare network's capacity to manage an increase of cases following deconfinement, well, clearly we're keeping an eye on that. And it's quite probable that for certain sectors that we will ask that certain sectors be delayed. And that's a dialogue that we've got with the National Director of Public Health. What would be the sectors for which you would recommend a delay of the deconfinement? Are we talking about schools and daycares or businesses? Or I'll be able to tell you that soon. Give us a bit of time to talk about it, but that's exactly what we're looking at. There are some sectors for which the contribution to community transmission can be greater, and schools is one of them. There are some sectors for which we think that perhaps a reopening can be done with certain precautions that will not contribute in a significant way to increasing the community transmission. And it is these sectors that we're looking at with our partners, but also clearly through a public health risk analysis. If you'll allow me. You said that there were close to 4,000 healthcare workers representing 20% of cases. Can you identify exactly if these healthcare workers are associated to hot zones? Yes, I didn't say it, and you'll see it in the pictures that will be published tomorrow. But clearly, in the neighborhoods, in the hot neighborhoods, there's an overrepresentation of healthcare workers, and it's very well illustrated. So I think they illustrate quite well. It's one of the elements that contributes currently to the fact that these neighborhoods are more of a hot zone.
Merci beaucoup. On va passer à Ruby Irène Pratka du Ricochet. Est-ce que Ruby, tu es en ligne? Nous allons passer à Dominique Cambron-Goulet du Journal de Montréal.
Oui, bonjour.
Hello.
Vous m'entendez bien?
Oui.
Alors, en fait, on a parlé tout à l'heure.
We talked earlier of Hochelaga. You talked about the fact that the eastern neighborhoods are more impacted. There's a lot of cases in the past few days in Rivière-des-Prairies, in Pointe-aux-Trembles. In these cases, is it, once again, healthcare workers? It's not quite the same profile of density as Montreal North or Mercier, Hochelaga, Maisonneuve.
I
would have to look. I think that, yes, I'm sorry, I don't know all the neighborhoods by heart, but you'll have all these answers tomorrow. And the increase in cases is expected in these neighborhoods. If we screen more in the hot neighborhoods, expect collectively to have an increase in cases in those neighborhoods over the next few days. It's just that we are now we're identifying them, we're isolating them and isolating their contacts and retracing the contacts and the environments in which they may have found themselves, which could be businesses or other types of environments. So we'll see that increase last. We'll see it in our numbers over the next few days because we're screening more in these neighborhoods. Apart from screening, are there factors, socioeconomic factors, that explain that the eastern part of the island has a greater risk? The health of the people in eastern Montreal is not as good as it is in the western part of the island. Does that have an effect? I would say the same factors that we talked about for Montreal North. Obviously, there's a healthcare worker component, but also essential workers and other types of businesses or industries that stayed open, whether it was in grocery stores or in manufacturing, in certain sectors. These people often, there's a greater density, or a greater urban density, but also in apartment buildings. So obviously, if we've got a healthcare worker who's got a family of 5 and they live in a 3 or 4.5, isolating the healthcare worker is not like when you live in a bungalow and you say to the person, well, sleep in the basement. So there's this all of these elements. And the portion of people who are more frail, we will see it more in the severe forms of the illness. So we would see it more in hospitalizations and emergency department visits and everything that has to do with intensive care and ultimately deaths. So that we'll have to keep an eye on that over the next few weeks to see it's vulnerable people who got the illness, or if it's middle-aged people but who are in good enough shape for whom the severe form of the illness has not manifested, which is what we hope for everybody.
Merci beaucoup. La parole maintenant à Laurent Lavoie du journal Métro.
Bonjour, ma question s'adresse à Mme Drouin.
Hello, my question for Dr. Drouin. In Saint-Laurent, there's a concentration of 115,000 workers in the industrial park, and the businesses are not adapted to social distancing. And the Chamber of Trade, to this we have to add the density. Does public health consider that Saint-Laurent is at greater risk for a new outbreak if we deconfine? Probably not because of the population, but today there's a mobile unit in that neighborhood. What we're going to have to work on in a zone such as this one, and we have to see if the businesses, if there are workers who also live in that neighborhood. But clearly, the reopening of these sectors requires preparation of the work environment. As I said earlier, we've got brigades, prevention brigades that go in the CHSLDs, et cetera, to prepare them so that they don't have cases. It's the same thing when it comes to workplaces. We've got teams in Santé au Travail, but also the inspectors. The CNSST inspectors are working in collaboration to make sure that the measures are in place before the reopening, and also to intervene and prepare them to act properly when there's a first case in an industry. So clearly, these environments are accompanied. They've got the directives depending on their sector of activity. This was worked on together with the CNESST and the Santé au Travail teams. There are big industries. Often they have more means to apply these measures in small work environments. So now we're thinking about how we're going to accompany smaller businesses, SMEs, to put these measures in place, because often they are at a disadvantage when it comes to their capacity to put the organizational measures in place. So I can't tell you if they're at greater risk today. Clearly, all the workplaces will have to adapt.
Est-ce que vous considérez que, en
Do you
raison
consider that because of the concentration
des travailleurs, mais aussi de la population qui habite là,
of workers that live there,
de nouvelles éclosions,
that there will be more outbreaks or new outbreaks? I would have to look. I don't think Ville-Saint-Laurent, there's probably some sub-neighborhoods where there is a greater urban density, but I think that there's neighborhoods where it's more, single-family homes, etc. So I don't think it's necessarily the size of the borough, but we have to look at the capacity of people to respect physical distancing and the measures that we're recommending, which help to limit the transmission of the virus. But I would have to look at each one of the boroughs to be able to answer your question. But the few times that I went in that borough, well, there might be some subsectors actually where we'd have to be more vigilant.
Merci beaucoup. Je vais donner une autre fois la parole à Ruby Irène. Es-tu en ligne?
Allô, bonjour, vous m'entendez?
Hello.
Oui, très bien.
Vous m'entendez?
Oui, tu peux poser ta question.
Est-ce que vous m'entendez?
Oui, on vous entend.
OK, merci beaucoup. Lors de votre intervention, il y a, je pense...
During your intervention about a week ago with Dr. Ruda, you gave us hope that there was going to be massive screening in Montreal North. And then there was some confusion that was created when you opened and closed and reopened the screening clinic. What will you do to dispel that confusion and make sure that we have screening in Montreal North? Currently, Montreal North has 2 fixed sites. The second one was open at my request. And what we asked to the CIUS is to keep it open until the mobile unit can go through the neighborhood. So the site will be open until Thursday, the second site. The first site, which has been functional for a few weeks, is going to remain open, and the mobile unit will be there for easily a week. It's going to go through the streets, and I think there's 3 arenas where the mobile unit will spend 2 days in each place, and we'll see afterwards if we have to keep it there for longer or if we'll send it to other neighborhoods. But clearly, I think that the objective is to maintain the service in Montreal North, whether it's fixed or a mobile unit. The idea is to have the service offered in the territory. What will you do to communicate the screening results to the people of Montreal North, given the confusion that we had over the past few days? Well, the schedule will be on our website, so we want to make sure we have to make sure that people have access to the places where the mobile units will be. And the way that we work is with the borough and the community organizers from the CIUS. So they have to do some work before the arrival of the mobile unit so that people know that the mobile unit will be present for 2 days in a targeted place. And I would say that in the past days, given that we were working and we were adding 1 bus at a time, clearly people did some work, but probably not enough to allow us to reach full capacity. Now, we've been trying to build a new concept for a week now, but I think that this week we'll be able to get the schedule well known, even in advance. The schedule is going to be done until Monday, and as of this weekend, and then afterwards we'll do the schedule for the next 2 weeks. It's possible that it changes a bit if we see that we have to reinvest in certain neighborhoods, but we're going to try to be more stable in our planning. But since this was the first week, well, it's always, we have to adapt and find the sites and staff the buses. And
Merci beaucoup, Ruby. We will now go
Thank
with
you.
English questions. I'm going to give the Max Harold from CTV Montreal.
Yes, hello. Can you hear me?
Yes.
Okay. Dr. Drouin, my questions are for you. First of all, what do the neighborhoods most affected by COVID-19 all have in common?
I think one thing that they have in common is that they have a higher proportion of healthcare workers that were infected in those neighborhoods. And we think that it may be the one explanation why the virus has reintroduced the community and is now being transmitted in the community. So I think this is one thing in common. The other thing that we see is that we're seeing that it is neighborhoods that are dense and with lots of apartments blocks. So the capacity for the population to respect the recommendation of keeping their distance, or when you're a case, you have to isolate yourself for 14 days. Sometimes in some contexts, it is quite impossible to do so. So I think maybe there's also, we have to think in those neighborhoods on how we're going to support those cases in their capacity to isolate themselves for the duration that we ask.
Okay, thank you. Second question, has public health ramped up or increased contact tracing? And what do you tell people who worry that contact tracing is an invasion of privacy?
Contact tracing is essential to the reduction of community transmission. We have a capacity right now. We have more than 350 investigators that are working for us. We're adding IT to this week to our process to make sure that we can do more with less energy, and we're introducing new investigator in our team. The way it is like as we do normally for mandatory infectious disease. They are declared to us. It is a nurse or an investigator who really respects confidentiality, who do the investigation, and we do contact tracing to make sure that people get isolated. But we're not using personal data, we're not transmitting those data to partners or whatever, and all the reports that we're doing are non-nominal, and we really want to make sure that we cannot identify some person. So even in some category that you'll see, if there is a number less than 5, we are not publishing it. So I think people should be aware that the confidentiality is respected. And at the same time, I want to remind people that it is important to respond to our investigators, because we still have contacts or cases that do not answer when we call them. And it makes difficult for us to make sure that all the recommendations are known and respected by the people.
Thank you.
Thank you, Max. Next question is from Kate McKenna from CBC. What do you say to people who say last week's press conference was a publicity stunt since there were no concrete measures announced for Montreal North?
I wouldn't say it's a publicity stunt. I announced on Tuesday last week the screening strategy. I announced lots of times during press conference the importance for Montrealers to continue to apply the public health recommendations. We were seeing that with the announcement at the provincial level of a reopening of certain sectors, the spring that was coming to us, that people were less applying those recommendations. And I asked Dr. Arruda to come in Montreal to explain the importance for Montrealers to apply, and that we are not finished in Montreal with the struggle to reduce the impact of this pandemic. So it was at my request that Dr. Arruda came, and I think the modelization that was published on Friday also gave a strong message to Montrealers. We're still fighting COVID-19.
Second question, how many people are currently employed or volunteering as contact tracers for Montreal Public Health, and is it enough?
But as I said, we have about 350 person or investigator working with us currently. We're adding IT to our process, and we have had other names given to us, but we're searching for specific profile, because when you're doing those investigation, you have to have at least formation, training or background in some in health to be able to explain to the people what COVID-19 to respond to their questions and their concern.
Prochaine question de Michel Lalonde de la Montreal Gazette. Can you please give us an idea of what proportion of new cases we are seeing in Montreal every day outside of seniors facilities? For example, of the 386 new cases recorded in the last 24 hours, what percentage approximately are in seniors' residences? Is it still the vast majority?
I don't have this right now, but I could find it easily.
Second question, Dr. Arruda spoke of the fact that people in certain neighborhoods are not showing up for testing in adequate numbers. How many tests are getting done per day in Montreal now? And what is public health doing to encourage Montrealers to get tested?
As I said, we've increased the testing for the population, the part that is not for healthcare workers, but for the population. But at this time, we still have capacity in our units. We can double the capacity, and by giving the schedules before, by doing outreach, I think the population will be there to increase and make sure we reach our goal.
La prochaine question est de Gloria Enriquez. Dr. Arruda said today that one of the reasons they were still going to close the testing site in Montreal North is that people were not going to get tested. What are you doing to convince people of different cultures to get tested?
But I think we have to work with the people in the community. We have to work with community groups, with the borough and the organisateurs communautaires who know how to reach and how to explain the importance of getting tested to those different the members of the community. And this is why mobile units are being launched, but are accompanied by an outreach strategy that is being done by those persons on the field.
Merci à tous. Thank you all. C'est ce qui conclut.
Thank you, everybody. That is all for our press conference today. Thank you.